At 11:42 p.m., a black government SUV hit the rain-slick stretch of I-5 outside San Diego. No skid marks, no swerve, just impact steel folding like paper. By midnight, Vice Admiral Nathaniel Crowe was on an operating table. By morning, the ICU heard one word that ends careers and closes doors: coma. But here's what no report will tell you. In that room, beneath the ventilator's steady hiss, the Admiral wasn't gone. He was listening. And the only person who noticed was a rookie nurse with a pen, a pulse oximeter, and the kind of calm you don't learn in textbooks. If you stay to the end, you'll see how a hospital monitor became a battlefield and how silence turned into a weapon. Now tell me where you're watching from and don't blink. That single flutter stayed with Brooke Callahan long after the monitor settled back into its perfect rhythm. It was the kind of detail that did not belong in a textbook. It belonged in the part of the job nobody warned you about, the part where a room could look peaceful, while something inside it fought like hell to stay hidden. Morning arrived without permission. San Diego light pushed through the thin blinds in the ICU, turning the glass partitions into pale mirrors. Outside, the city moved on. Inside, time crawled on soft shoes. Brooke came in early, hair still damp from a rushed shower, the smell of hospital soap clinging to her hands no matter how hard she scrubbed. Her badge felt too clean, too new. Her shoes squeaked once on the polished floor, and she hated that they did. The night nurse gave report in a voice sanded down by fatigue. Bed 12 is our VIP, Crowe Nathaniel. Vent dependent. Neuro says deep coma. Family not here yet. Federal liaison has a visitor pass. Brooke kept her face neutral, pen moving across the page. She wrote what she was supposed to write. Vent settings, oxygen rate, blood pressure. Pupils equal and reactive. No purposeful movement. She wrote it all, but her mind kept returning to the flutter she had seen when she asked him not to move. Sedation, Brooke asked. Minimal, the night nurse said. They backed off after surgery. He should be stormy. He is not stormy. Stormy. That was the word nurses used when bodies fought the machines, when numbers swung hard, when a patient refused to stay quiet. Brooke nodded once and walked toward bed 12. The room looked like every other ICU room until you noticed the extra layer of distance around it. A security camera angled down from the corner. A second badge reader on the doorframe. 2 men in suits lingering at the nurse's station, too clean for a hospital, too still for people with nowhere to be. They were not speaking loudly. They did not have to. Their presence did the talking for them. A bruised bloom climbed his neck and disappeared under the collar of a hospital gown. His left temple showed the faint outline of surgical sutures. Machines stood around him like sentries, and the monitor sang its calm song. Brooke stepped close and let herself listen. She had learned early that every machine had its own personality. Some beeped like they were warning you. Some beeped like they were bored. This one sounded obedient. Too obedient. She started with the basics. She checked the IV lines, traced them with her fingertips the way her instructor had taught her, slow and deliberate. She confirmed the medication drips. She confirmed the ventilator settings. She checked the tape holding the tube in place and smoothed the edge that had begun to peel. Then she did what she always did when she was alone with a patient, even one who could not answer. "Good morning, Admiral Crowe," she said softly. "It is Brooke. I am your nurse today." A nurse's voice could be a tool. It could calm families. It could steady a patient who was awake and terrified. It could also be a test, a way to see if anything in the body responded to being addressed like a person. She watched the monitor as she spoke. Nothing changed. She checked pupils with a penlight, one eye, then the other. Both constricted cleanly with the light, then widened again when she pulled the beam away. That was normal. Too normal, given what she had read in the report. She pressed her fingers along his wrist and felt a pulse that did not stumble. She looked at his chest rising and falling in perfect agreement with the ventilator. She listened to the hiss of oxygen and the soft click of valves inside the machine, a sound like measured breathing made mechanical. Brooke tried to picture the crash. Wet highway. Black SUV. The clinical words in the report did not match the image in her mind of a vehicle folding at speed. They did not match the bruises on his body. They did not match the calm in his numbers. She stepped out to the nurse's station to check the chart again, then looked up and saw the names printed at the top of the visitor log. Miles Carver. It was typed like any other visitor, but the way people spoke his name was different. It came with caution. It came with the sense that saying it too loudly could invite him into the room. Brooke leaned toward the charge nurse, an older woman named Denise, who had been in critical care long enough to stop getting surprised by anything except paperwork. "Who is Carver?" Brooke asked. Denise did not look up from her screen. "Defense Department liaison. He is not family. He is not clergy. He does not like being told no. Why does he have access?" "He says he has access," Denise said. "And someone upstairs agrees." Brooke nodded, as if she accepted that. She did not. She went back into bed 12 and stood a moment longer than she needed to, letting her eyes move across the room, the way a careful person scanned a street corner. The camera, the badge reader, the way the blinds were always half closed, the way the staff spoke in softer voices here. She looked at the Admiral's face. The bruising had turned the color of old ink. His jaw was still, but the muscle beneath the skin had shaped the kind that came from training from clenched teeth and long days. The man on the bed did not look soft. He looked paused. Brooke reached for his hand to check capillary refill, pressing the nail bed and watching the color return. His fingers were warm. His skin responded normally. She watched the monitor out of habit. Nothing changed. She tried a stronger stimulus, the kind you did when the neurologist wanted data and the family wanted hope. She pressed firmly into the nail bed again, not cruel, but not gentle. She watched his face for a twitch, his shoulder for a shrug, anything that said his nervous system still fought for him. Nothing moved. The monitor did not flinch either. Heart rate held. Oxygen held. The body did not even pretend to protest. Brooke let his hand rest back on the sheet and forced herself to breathe slowly. A coma patient could look calm. A coma patient could have stable vitals. But stable was not the same as controlled. Controlled had intention in it. She turned the thought away, like you turned your face away from smoke. Later that morning, Dr. Sloan Mercer came in with a small group of residents and a clipboard that looked too crisp for the hour. Dr. Mercer had the kind of voice that made families nod even when they did not understand. It was smooth. It was certain. It was used to being obeyed. She stood at the foot of the bed and spoke as if the Admiral were a chart number. Diffuse axonal injury suspected. Post-operative imaging shows swelling. No voluntary response. No command following. One resident asked sedation could be masking. Dr. Mercer's eyes did not shift. Sedation is low. This is coma. Brooke stood near the IV pump hands, still face blank. She listened the way she listened to a radio in a storm, trying to catch what mattered. Another resident asked prognosis. Dr. Mercer answered without hesitation. Guarded. Prepare for long-term care planning. Long-term. The phrase landed like a weight. It was the first shove toward a door that closed slowly. When rounds moved out, Brooke followed Dr. Mercer into the hall. "Doctor," she said, keeping her voice respectful, "can I ask about the stability of his vitals?" Dr. Mercer glanced at her badge and let the smallest flicker of impatience show. "What about them?" "They are very steady," Brooke said, "even with stimulation." "Ventilator support can create stability," Dr. Mercer replied. "So can aggressive management." Brooke held her ground. His oxygen saturation drops during certain interactions and corrects quickly. It is timed. Dr. Mercer's mouth tightened a fraction. Autonomic fluctuations. That happens. Brooke wanted to say that autonomic fluctuations were messy. They spiked. They stuttered. They did not correct like a hand turning a dial. Instead, she asked, have we ruled out locked-in syndrome. The air in the hallway cooled. One of the residents shifted his weight. Dr. Mercer's eyes sharpened. "He shows no voluntary movement," she said. Brooke nodded once because arguing in a hallway did not win anything. She watched Dr. Mercer walk away and felt the sensation she hated most, the sensation of being politely dismissed. At lunchtime, Brooke ate half a sandwich she did not taste. The television in the break room ran a silent clip of a press conference. A Pentagon SEAL behind a podium. A statement in clean language about tragic timing and prayers. A nurse across from Brooke pointed at the screen with a chewed straw. "They say he came out of a classified meeting," the nurse murmured. Then drove into a wall. Brooke looked at the nurse. "Who is they?" "News," the nurse said, as if that explained everything. Brooke sat back and let the soundless footage roll. She imagined the Admiral leaving a room full of people in uniforms and suits carrying something heavy that did not fit in a briefcase. She imagined him walking toward his car with the kind of focus that made other people step aside. She imagined him behind the wheel rein on the windshield highway lights stretching into a blur. And she imagined the moment the brake pedal went down and nothing happened. The thought made her throat feel tight. After lunch, she asked Denise for access to the initial crash intake notes. Denise raised an eyebrow. "You are very curious for a new hire," Denise said. "I want to understand my patient," Brooke replied. Denise stared at her for a long beat, then tapped keys and slid a printed page across the counter. Brooke read it quickly. Time, location, weather, mechanism of injury. She found the line that had haunted her since the night report. No visible skid marks at scene. She read it again. No skid marks meant the tires never locked. It could mean the driver never braked. It could mean ABS prevented the skid. But even with ABS, there were usually traces. There were usually signs of correction. A swerve, a scrape, a last-second attempt to change the story. Her eyes moved lower. Vehicle, telematics pending. Pending. The word was a closed door. She slid the page back to Denise. "Do we ever get the telematics? If someone wants us to," Denise said. "Sometimes we do. Sometimes we get a summary and a warning not to ask questions." Brooke nodded. She thanked her and walked back to bed 12 with her hands empty and her head full. Inside the room, the Admiral's numbers were still perfect. Brooke took vital signs manually, even though the machines already displayed them. It was partly habit, partly an excuse to be close, partly a way to remind herself she was dealing with a human body, not a clean set of digits. She placed a stethoscope to his chest and listened. Heart sounds were strong, regular, unbothered. She moved to his lungs. Air moved in and out with the ventilator's cadence, nothing coarse, nothing frantic. She stepped back and looked at his face again. If he could hear, he had chosen not to show it. If he could hear, he was disciplined enough to hold still while a room full of doctors spoke about feeding tubes and facilities and time. Brooke leaned close to his ear, careful to keep her mouth hidden by the edge of her mask. "Admiral," she said soft enough that the ventilator nearly swallowed her words. "If you are in there, I am not asking you to prove it. I am asking you to stay alive." She watched the monitor. Nothing changed. For a moment, she felt foolish like a kid talking to a closed door. Then she remembered the flutter. She stepped to the computer in the room and opened the full monitor log, the detailed activity stream most people only looked at when something went wrong. It was dense with timestamps and trends. It was the closest thing to a witness statement a machine could provide. She scrolled back to the night shift to the minute Carver had entered. She found the drop in oxygen saturation exactly 2 points, and the recovery that followed. She checked the time against the visitor log. The times matched. Brooke's heartbeat quickened. She did not let it show. She copied the timestamp onto a blank sheet and tucked it under her clipboard. She did not put it into the official chart. Not yet. Later that afternoon, the room outside bed 12 became busy, in a way it had not been earlier. A hospital administrator in a fitted blazer moved with purpose, stopping at the nurse's station to speak quietly with Denise. A man in a suit stood near the doorway to the ICU wing, reading something on his phone and pretending not to watch the nurses. Brooke caught Denise's eye. Denise jerked her chin toward the admin. "That is Lydia Park," Denise said under her breath. "She is here because someone called her." Brooke watched Lydia Park step toward Dr. Mercer, the two of them talking in low tones. Brooke could not hear the words, but she could read the body language. Dr. Mercer's posture was firm. Lydia's smile was tight, professional, polite in the way a locked door was polite. A few minutes later, Lydia Park stepped into bed 12 with Dr. Mercer at her side. Brooke stayed near the IV pump hands occupied. Lydia glanced at the Admiral as if he were a problem to be solved. "We have inquiries," Lydia said to Dr. Mercer. "Federal level, they want clarity on the plan." Dr. Mercer replied, "The plan is medical. Stabilize, monitor." Lydia's smile did not widen. "They want timelines." Dr. Mercer's voice stayed calm. "Neurology does not operate on timelines." Lydia leaned slightly closer, lowering her voice. "They do." Brooke kept her eyes on the medication bag, but she heard every syllable. Lydia's attention shifted briefly toward Brooke. "And you are," Lydia said. "Brooke Callahan," Brooke replied. "Primary nurse, this shift." Lydia nodded. "Chart carefully." "I always do," Brooke said. Lydia held her gaze a fraction longer than necessary, then left. When the room quieted again, Brooke stood at the bedside and stared at the Admiral's hand. It rested on the sheet, fingers relaxed, no tension visible. His face remained still. Nothing gave away the mind that might be present. Brooke whispered, "There is pressure to move you." She watched the monitor for any response. Nothing. She tried again, not louder, just clearer. "If you can hear me, do nothing." The request sounded ridiculous even inside her own head. It was asking for proof by absence. But the absence was the whole point. If he was hiding, staying still was not only possible. It was the strategy. A full minute passed. The ventilator hissed. The monitor beeped. Brooke stood so still she could feel the ache in her calves. Then she saw it. Not a spike. Not a dramatic alarm. A single subtle tightening in the rhythm, a line that shifted by a hair and then returned. If you were not watching for it, you would not know it happened. Brooke swallowed. Her palms went damp inside her gloves. She turned away and wrote down the time. When Denise came in to help with another patient, Brooke found a moment to speak. "Denise," she said quietly, "do you know why the federal liaison keeps visiting?" Denise sighed. "Officially, he is there for coordination. And unofficially," Denise looked at Brooke as if weighing whether she deserved an answer. "Unofficially, he is there to make sure the hospital stays helpful." Brooke did not like the way helpful sounded. "I saw the oxygen dip when he came in," Brooke said. Denise's eyes flicked to the monitor, then back to Brooke. "If you are going to say something about that, make sure you can defend it." "I am not saying anything," Brooke replied. "I am documenting." Denise studied her for a moment, then nodded once. "That is smarter." Brooke returned to her tasks, but her focus sharpened into something like a blade. She began to treat the monitor log the way an investigator treated a timeline. She tracked every small deviation and matched it to a person entering the room, a word spoken at the bedside, a change in lighting, a touch on the patient's skin. Patterns began to appear. Not constant, not obvious, but present. The Admiral's numbers did not respond to pain the way she expected. They did not respond to a cold wipe on the skin. They did not respond to the dimming of lights. Those things caused the small normal shifts you saw in any ICU patient. Nothing that hinted at a conscious mind. But the mention of Miles Carver did something. Brooke tested that carefully, quietly, like a person checking if a floorboard creaked. She did not say the name often. She said it once in a neutral voice as if it were part of normal conversation. "The liaison may come by again," she murmured near the Admiral's ear. The heart rate ticked up 3 beats and settled again. Brooke repeated the test hours later when the room had been empty and calm for a long time. "Carver is in the corridor," she said, even though she did not know if he was. The heart rate did it again, almost identical. Her stomach tightened. She forced her face to stay calm as she checked the IV pump. If the Admiral heard, he was doing exactly what Brooke would do if she were trapped inside her own body. He was controlling what he could control. Breath. Heart. The smallest signals. The things a soldier learned to command when everything else was taken. As evening approached, Brooke took a call light from another room, returned, and found a new note attached to Bed 12's chart. Transfer Planning Review. She stared at the words for a moment, then looked toward the hall. Lydia Park stood near the nurse's station again, phone to her ear, eyes sweeping the unit like she owned it. Dr. Mercer walked beside her, expression unreadable. Brooke stepped into Bed 12 and closed the door gently, leaving it cracked just enough to avoid suspicion. She leaned close to the Admiral. "They are already talking about moving you," she said. "They are talking like it is a scheduling issue." The monitor remained steady. Brooke's voice lowered. "If they move you to a military facility, you will disappear behind procedures I cannot see." The ventilator breathed on. The Admiral's face did not change. Brooke waited, watching for the smallest fracture in the calm. There was none. He could be unconscious. He could be trained beyond anything she understood. Or he could be both locked in by injury but awake enough to hear and hold the line. Brooke stepped back, forcing herself to return to the normal rhythm of work. She changed IV bags. She assessed skin. She updated documentation. She spoke to him as if he were awake because it cost nothing, and because some part of her could not accept treating a living person like a closed file. Near the end of her shift, Dr. Mercer returned to Bed 12 with a tablet and a tired expression. "We are scheduling another scan," Mercer said to Brooke. "Continue supportive care." Brooke nodded. "Doctor, has anyone requested an advanced stimulation test? Beyond the basic exam." Dr. Mercer's eyes hardened, not indicated. Brooke kept her voice even. "His pupil response is strong. His vitals are stable to an unusual degree. There are timed changes with specific environmental cues." Mercer's jaw tightened. "You are seeing what you want to see." Brooke did not flinch. "I am seeing what the monitor records." Dr. Mercer stared for a beat, then looked away. "Chart. Do not interpret." Brooke watched Mercer leave and felt heat rise behind her ribs. She pushed it down. Anger did not help in a room full of cameras and quiet power. Only precision helped. She stayed late to finish notes. She did not write accusations. She wrote observations. She wrote times. She wrote numbers. She wrote the kind of language that survived scrutiny. When she finally stepped out into the corridor, the ICU lights were dimmed to night mode. The hall, quieter, voices softer. The two suited men were gone, replaced by a single guard near the entrance who looked bored and alert at the same time. Brooke walked back to Bed 12 one more time before leaving. She stood near the Admiral's head, close enough to speak without raising her voice. "Admiral Crow." She said, "I do not know what you are protecting. I do not know who you are protecting it from. But I know someone is coming into this room and speaking like you can hear him." She paused and listened to the ventilator. "I am not asking you to move," she said. "I am asking you to keep control." The monitor held steady, obedient. Brooke nodded once as if she had received an answer. She turned to leave. Her hand was on the door when she heard footsteps in the hall, measured and unhurried, the sound of leather soles that did not belong to hospital staff. She looked through the narrow opening and saw Miles Carver's badge catching the light as he approached, his expression calm, his eyes already on the room. Brooke stepped back inside and picked up her clipboard pen, poised as the door began to open. Miles Carver did not knock. He opened the door the way people opened doors when they believed the room belonged to them. The badge on his lapel caught the low light, a clean rectangle of authority. His suit looked dry despite the damp night outside. His hair was combed with care that did not belong in a hospital at shift change. He stepped in, closed the door behind him until it was nearly shut, and let his eyes travel across the bed and the equipment with quick, practiced comprehension. Brooke kept her posture loose, clipboard held in both hands, pen resting against paper. She did not stand between him and the patient. She did not retreat either. Carver looked at the ventilator screen, then the monitor, then the Admiral's face. He let his gaze linger as if he were reading something on the skin. "You are still here," he said. "I am finishing charting," Brooke replied. Her voice stayed mild. "If you need privacy, I can stand at the far side of the room." Carver's eyes met hers, then slid away. "That will do." He moved to the bedside with a quiet confidence that did not ask permission. Brooke stepped toward the IV pump and pretended to review drip rates. She could see Carver's reflection in the glass partition, could see how he positioned himself so his mouth was close to the Admiral's ear, could see the slight angle of his shoulders that made his body a shield against cameras. His voice dropped until it became more vibration than sound. "You should have stayed out of that vote," he whispered. The Admiral's face did not change. The chest rose with the ventilator. The hand lay still on the sheet. The monitor did the only reacting. Oxygen saturation fell 2 points in a clean, smooth dip, then recovered to baseline with the same smoothness. Heart rate tightened, not a spike, not fear more like a deliberate narrowing. It held there for a breath, then eased back into place. Brooke stared at the numbers without moving her head. She felt her pulse thrum behind her eyes. She forced her breathing to match the steady pace of work. If she looked startled, she would become part of the story Carver was writing. Carver stayed close to the Admiral's ear a few seconds longer. "You are going to be moved," he murmured, quietly. Then he straightened and turned his head slightly as if he could sense Brooke watching, even when she kept her eyes lowered. "You have everything you need?" he asked. "Yes," Brooke said. Carver nodded, once satisfied with an answer that revealed nothing. He walked out as smoothly as he had come in. Brooke did not exhale until the door latched. She walked to the sink, washed her hands, though they were already gloved, then removed the gloves with slow precision and replaced them. The motion gave her something to do while her mind kept replaying the dip in oxygen. The timing, the recovery, the way it looked like the body had been told to stay calm and had obeyed. She went back to the bedside, leaned close enough that her voice would not carry, and kept her face turned slightly away from the camera. "Admiral Crowe," she whispered, "if you can hear me, do not move." The ventilator hissed, the monitor beeped. Nothing happened for a long moment. Brooke held her breath without meaning to, then forced herself to inhale slowly. A small flutter appeared on the heart rhythm, so minor it could be dismissed as machine noise. It could be. It could also be a man saying the only thing he was willing to say. Brooke straightened. She wrote down the time the oxygen dipped the heart rate shift. She did not write an interpretation. She did not write Carver's words. She wrote only what a machine could confirm. She finished her shift with her mouth shut and her eyes open. At home, she lay in bed and listened to the rain start up again. She tried to sleep, but the beep of the monitor had followed her. It lived in the space between her thoughts, steady and calm and wrong. In the early hours before dawn, she gave up. She sat at her kitchen table with a mug of coffee she did not taste and stared at the notes she had copied onto a small pad. Times, numbers, small deviations. It looked harmless. It looked like any nurse's work if you ignored the way her handwriting tightened around Carver's visits. She kept the pad in her bag, not on her phone, not anywhere that synced or uploaded. Paper was old-fashioned, but paper did not ping, did not back itself up to a cloud she could not see. She arrived at the hospital before shift change, walked past the front desk with a polite nod, and rode the elevator up with 2 residents who smelled like energy drinks and exhaustion. In the unit, Denise was already at the station sipping coffee and staring at the schedule. "You are early," Denise said. "I could not sleep," Brooke replied. Denise's eyes flicked toward the bed 12. "You do something to your head." Brooke hesitated just long enough to decide honesty could be safe if it stayed inside the boundaries of fact. "The liaison came back," she said. His numbers changed again. Exactly again. Denise's mouth pressed into a line. "Write it." "I did," Brooke said. "Write it clean," Denise added. "If you keep a separate log, keep it separate. Do not blend it into the chart unless you are ready to defend every syllable." Brooke nodded. "What about security?" Denise let out a slow breath. "Security answers to administration. and administration answers to whoever is calling Lydia Park. You can ask for an extra set of eyes if you have a reason. Make sure your reason is something you would say out loud in a meeting. Brooke looked at Denise, grateful and unsettled at the same time. Is that your way of telling me to stop? Denise held her gaze. It is my way of telling you how to survive. Brooke went into bed 12. The Admiral lay, as he had still quiet a man reduced to lines and numbers, and a name that made people whisper. Daylight softened the edges of the room but did not change the atmosphere. The camera remained angled. The badge reader remained dark and watchful. Brooke checked the ventilator. She checked the IVs. She checked the chart. She checked the Admiral's skin for breakdown, his mouth for dryness, his eyes for irritation. She performed every task with care that felt almost ceremonial. Then she did something small, something she could justify as routine if asked. She turned the ventilator flow rate down a fraction within safe parameters, just enough to demand a touch of work from the lungs if the body could offer it. She watched the chest rise and fall. The ventilator did its job. For several breaths, nothing else happened. Brooke leaned close, the side of her mouth hidden from the camera by her shoulder. If you are aware, she whispered, match your breathing to mine for 3 seconds. She breathed in slow. She breathed out slow. She counted in her head, keeping her face calm. On the 3rd second, a faint extra effort joined the mechanical rhythm. It was not a cough, not a spasm, not the chaotic struggle of a body fighting a tube. It was subtle, like a hand resting lightly on a door that had been shut. Brooke's stomach dropped. Her scalp tightened with adrenaline. She did not let her eyes widen. She did not jerk away. She returned the ventilator setting to where it had been, then wrote down the time. A person might ask why she did not call a code, why she did not run into the hall and shout. Brooke knew the answer, even as the thought formed. If the Admiral was hiding, noise would only help the wrong people. If she was wrong, noise would destroy her. She needed more than a feeling. She needed a pattern no one could wave away with a polite smile. Later during rounds, Dr. Mercer came in with the same crisp certainty. Brooke stood near the pump, waiting until Mercer's attention flicked toward her long enough to speak. Dr. Brooke said. Mercer looked at her patients, already thinning. Yes. I adjusted ventilator support briefly to assess spontaneous effort, Brooke said. She kept her words precise. There was a measurable change in his breathing pattern in response to a verbal cue. Mercer's expression flattened. He is ventilated. Ventilators have variability. Brooke held steady. The timing matched the cue. Mercer's gaze sharpened, and for a second Brooke saw not annoyance but calculation. You did a command test, Mercer said. I did a safe stimulation check, Brooke replied. Within parameters. Mercer stepped closer. Do not improvise with my patient. He is my patient, too, while he is on this unit, Brooke said, then regretted the phrasing as soon as it left her mouth. The residents went quiet. One of them stared at the floor. Mercer's voice dropped. He is a federal patient. He is a neurological catastrophe. You are a new nurse. Chart care do not chase ghosts. Brooke nodded once, as if she agreed, as if obedience were the only thing she had. Mercer left. Brooke turned back to the monitor and watched the rhythm stay perfect. That afternoon, a social worker stopped by bed 12 with a file and the cautious expression of someone walking into a storm. Any family contact, the social worker asked. Not yet, Brooke said. The woman glanced around, lowering her voice. They are saying family will be handled by liaison. Brooke kept her face blank. Who is they? The social worker gave a small, helpless shrug. Administration. Brooke watched her leave and felt the same cold pressure in her chest she had felt when Mercer dismissed her. It was not only medical now. It was procedural. It was political. At 3:30, Miles Carver returned. Brooke saw him before he entered. She noticed the way the unit's temperature seemed to shift when he walked through the doors, not physically but socially. Conversations softened. People stepped aside. The guard by the entrance straightened. Carver greeted no one. He walked straight to bed 12 and tapped his badge at the reader. The door clicked open. Brooke was already inside pretending to update charting on the room computer. Carver stopped just inside the door and looked at her. "You again," he said. "I am assigned," Brooke replied. Carver's eyes moved to the monitor, then back to her. "You chart in the room. It is easier to keep data accurate," Brooke said. Carver nodded, as if he respected accuracy, then stepped toward the bed. "I would like privacy," he said. Brooke let her hand hover over the keyboard. "Hospital policy requires staff remain available for ventilated patients during visitation." Carver looked at her as if he were deciding whether to smile. "You are quoting policy to me." "I am stating it," Brooke said. He studied her for a beat, then moved closer to the Admiral. Brooke stayed where she was, hands busy, eyes on the monitor. She watched the oxygen saturation, watched the heart rate, watched the clean lines that told a story without words. Carver leaned in. He did not whisper immediately. First, he spoke at normal volume, the voice of a man playing the role of concerned official. "Dr. Mercer tells me there is no meaningful improvement," he said, looking at the Admiral's face as if the Admiral could appreciate the performance. "I am told the injury is severe." The monitor remained steady. Then Carver lowered his mouth to the Admiral's ear and let the mask fall. "It would be much simpler if this stayed quiet," he whispered. Heart rate rose 5 beats clean and controlled, held for 3 seconds, then eased down like a hand turning a dial back to 0. Oxygen dipped 1 point, then recovered. Brooke did not look up. She typed a few meaningless keystrokes and listened to the room as if she were listening to a weapon being cocked. Carver straightened and turned slightly enough to catch Brooke's reflection in the glass. "You hear that?" he asked, casual. "I hear the ventilator," Brooke replied. Carver's mouth curved faintly. "That is a good answer." He walked out. Brooke waited until the door clicked shut. Then she stood and moved to the bedside, adjusting the IV line for show. "Sir," she whispered. "If you can hear me, keep still." The monitor stayed obedient. Brooke stared at the line, willing it not to move. She did not want a dramatic sign. A dramatic sign would invite more eyes, the wrong eyes. She wanted the steady silence that meant the Admiral understood what was at stake. A long moment passed. Then, barely visible, the heart rhythm tightened once and returned. Brooke felt her mouth go dry. She swallowed and stepped back. When she left the room, she did not go to the station. She went down the hall to the supply room where the cameras were pointed at shelves, not at faces. She closed the door and stood among boxes of syringes and gauze, breathing slowly. She pressed her palms against her thighs until the trembling stopped. She was not afraid of a coma patient. She had handled dying people. She had held hands as monitors flattened into silence. She was afraid of what it meant when a living man had to pretend to be dead in front of the government. She returned to the station and asked Denise for something that sounded ordinary. "Can I pull the full monitor activity log from the last 24 hours?" Brooke asked. "For the trending." Denise looked at her, then nodded once. "Use the system. Do not export it to anything personal." "I will copy timestamps by hand," Brooke said. Denise's eyes narrowed slightly, then softened. "You are learning." Brooke printed the log to the unit printer, then carried it back to the station and sat with her shoulder angled so no one could easily read over her. She traced each time the oxygen dipped and compared it to the visitor log. She compared it to medication administration. She compared it to suctioning and turning and routine care. Most dips matched care events. Suctioning lowered oxygen briefly. Repositioning shifted heart rate. But Carver's time stood apart. The dips were smaller, cleaner. The recovery was immediate, and the start of each deviation aligned with the exact minute he leaned in close. Brooke wrote the timestamps on her pad and tucked the paper away. That evening, while the unit dimmed and the rest of the hospital settled into night, Brooke heard a voice in the corridor she recognized, low and urgent. She stepped to the doorway of a patient room across from bed 12 and pretended to check the IV pole while she listened. Miles Carver stood at the far end of the corridor with his phone to his ear. His back was half turned, but his posture gave away impatience. "If he wakes up, we have a serious problem," he said. Brooke kept her head lowered. Her heart pounded so hard it made her ears ring. A pause. "No," Carver continued. "The doctors are saying the damage is permanent. The neurologist has already signed off." Brooke felt cold slide down her spine. Another pause. "Yes," Carver said. "Transfer clears it." He ended the call and slipped the phone into his pocket. He turned slightly, and for a moment Brooke thought he had seen her. She kept her face blank and continued adjusting the IV pole as if she belonged there. Carver walked away. Brooke waited until his footsteps faded, then moved quickly, not running, not drawing attention back to bed 12. Inside, the Admiral lay exactly as before, eyes closed, mouth taped, chest rising with the machine. The monitor kept its steady line. Brooke stepped close. "I heard him," she whispered. "I heard what he said." She watched the monitor. Nothing changed. She leaned in, more voice dropping to the smallest breath. "He believes you will not recover." The heart rate did not spike. It tightened, a small controlled rise of 3 beats, then returned. The kind of restraint that took training. The kind of restraint that made anger into a weapon instead of a reaction. Brooke's throat tightened. "Do not react," she whispered. "Stay still." The monitor obeyed. In the stillness, Brooke understood a piece of the Admiral she had not wanted to understand. If he was conscious, he was choosing silence not because he was weak, but because silence gave him leverage. And someone out there was trying to use medicine as a lid. Brooke did not sleep much that night. She finished her shift, went home, washed her hands until her skin stung, then sat at her kitchen table again with her pad of notes and the printed log folded inside a paperback novel like contraband. She stared at the times until they blurred. At 6 in the morning, she returned. The unit smelled like bleach and coffee. The night shift looked hollowed out. Denise gave report with eyes that had seen too much to be dramatic. "Carver came twice," Denise said softly. "Dr. Mercer is on edge. Administration is coming down later." Brooke nodded. "Any new orders?" Denise hesitated. "Just the scan, and keep charting tight." Brooke walked into bed 12 and found Dr. Mercer already there, standing at the foot of the bed with Lydia Park. Lydia held a tablet. Mercer held her composure. Their voices lowered when Brooke entered, then resumed with the forced ease of people pretending they were not speaking about a problem. Lydia's smile was polite. "Nurse Callahan correct." "Yes, we are coordinating long-term placement options," Lydia said. Dr. Mercer's eyes flicked toward Brooke with a warning that was not subtle. Brooke kept her voice even. "He is still within acute care window." Lydia nodded. "That window is not unlimited." Dr. Mercer spoke calm and clipped. "He is non-responsive. The prognosis is poor." Brooke's mouth went dry. She looked at the Admiral's face, then at the monitor. It stayed steady as if the man on the bed were listening to every word and refusing to give them anything. Brooke turned back to Mercer. "Doctor, I am requesting an advanced stimulation test. A structured protocol. We can document whether there is any command following." Mercer's eyes narrowed, not indicated. Brooke held her ground. "I have observed timed physiological changes associated with specific verbal cues and specific visitors." Lydia Park's expression shifted a small crack in the professional mask. "Specific visitors." Brooke kept her gaze steady. "Yes." Mercer stepped closer, voice low. "You are overstepping." Brooke spoke carefully, choosing words that sounded like nursing, not accusation. "I am advocating for appropriate assessment." Lydia's eyes moved between them. "We will discuss this outside." They left the room, and the door closed behind them. Brooke stood by the bed, listening to the ventilator, watching the monitor, feeling the pressure build in the air like static before a storm. She leaned close to the Admiral's ear. "They are talking about moving you like a file," she whispered. "I am going to keep documenting what the machine records. I need you to keep control." The heart rhythm stayed calm, obedient, silent. Brooke straightened and returned to her charting station inside the room. She pulled up the monitor's detailed trends, and as she did, she heard the door open behind her. Miles Carver stepped in. His expression looked the same at first glance, calm, neutral, professionally bored. Then Brooke noticed the difference. His eyes did not go straight to the Admiral this time. They went to her. "You are very involved," Carver said. Brooke did not swivel in her chair. She kept her attention on the screen as if she were a nurse with nothing more pressing than numbers and timestamps. "He is my patient," she said. Carver moved closer, stopping at the foot of the bed. He rested one hand lightly on the rail, casual ownership. "You understand the national importance of his condition," he said. Brooke looked up now, slow and controlled. "I understand the medical importance." Carver held her gaze longer than comfort allowed. "Some situations are bigger than one patient." Behind him, the heart monitor rose 5 beats, held steady, then returned to baseline with clean precision. Brooke saw it. She watched Carver's face for any sign he noticed. Carver's eyes flicked to the monitor, then away as if he had trained himself not to acknowledge what machines revealed. His mouth tightened just slightly. Then he leaned toward the Admiral, lowering his voice again to a whisper meant for one man. "No one else needs to know," he said. Brooke watched the Admiral's numbers respond with disciplined restraint. The oxygen dipped a point and recovered. The heart rate tightened, held, then released. Carver straightened. He turned toward Brooke. "You should focus on your tasks," he said softly. Brooke's voice stayed level. "I am." Carver's gaze lingered on her face, searching for fear. Brooke gave him none. She returned her eyes to the screen and typed a note into the chart that said nothing about what mattered. Carver left. When the door shut, Brooke's hands paused over the keyboard. She forced them to keep moving. She understood something then, with a clarity that made her stomach sink. She was not simply watching a powerful man threaten a wounded one. She was inside the line of fire now, and the person across the hall was adjusting his aim. Brooke printed the latest activity log and folded it into her pocket. She walked out of bed 12 and went to the nurse's station where Lydia Park stood with her tablet speaking quietly to someone on the phone. Lydia's smile did not reach her eyes. Brooke waited until Lydia ended the call. "Mrs. Park," Brooke said. Lydia looked at her. "Yes, I would like to submit a request for secondary neurological review," Brooke said. "A formal one." Lydia's expression remained pleasant, but her voice cooled. "That would be a significant step." Brooke nodded. "So is moving him." Lydia studied her for a moment. "I will speak with Dr. Mercer." Brooke did not argue. She did not plead. She returned to bed 12, closed the door gently, and stood beside the Admiral with the quiet patience of someone who knew time could be a weapon. She leaned close one more time. "Do not give them anything they can twist," she whispered. "Stay still." The monitor stayed steady, perfectly obedient. Outside the room, the unit phones rang, and quiet voices moved through clipped conversations. Brooke listened without listening, the way you listen to a radio while keeping your eyes on the road. She kept charting, she kept watching, and every time a leather sole approached in the corridor, every time a badge reader clicked, she kept her face calm and her pen moving, as if she were only doing the job she had been hired to do. The unit did not get louder after Carver left. It got quieter, as if the building itself had learned to hold its breath. Brooke stayed in bed 12 until her hands stopped shaking. She kept charting, kept clicking through tabs, kept the cursor moving so anyone glancing through the glass would see a nurse doing what nurses did. Every few minutes, her eyes drifted back to the monitor, not because she expected a miracle, but because the machine had become her most honest co-worker. At the nurse's station, Lydia Park's voice carried in a low, controlled stream. It did not matter what words she used. Brooke heard the tone. Deadlines, options, coordination. The kind of language that sounded harmless until it pushed a patient through a door that did not open back up. Denise came to the doorway of bed 12 and leaned in, her shoulders angled, as if she were checking a room, but her eyes on Brooke. "Conference room," Denise said softly. "Now." Brooke smoothed the front of her scrubs and stepped into the hallway. Her badge felt heavier than it had at the beginning of the week. The conference room sat at the edge of the ICU wing, a glass box, with a table that smelled faintly of disinfectant and cold coffee. Lydia Park stood at the head of the table with a tablet in her hands. Dr. Sloan Mercer sat to the right posture, straight fingers folded. A case coordinator Brooke had only seen once before sat beside Mercer with a file and a practiced smile. Two men Brooke did not recognize occupied the far end of the table suit's neutral faces, eyes that did not blink much. Lydia did not offer a chair. She did not have to. Nurse Callahan Lydia said, her smile polite and tight. "We need alignment." Brooke remained standing. "On what exactly?" "The plan of care," Lydia replied. "The communication plan, the placement plan." Dr. Mercer's eyes flicked up. "This is not a placement discussion. It is a prognosis discussion." Lydia's gaze stayed on Brooke. "It becomes placement when the prognosis stays the same." The case coordinator opened her file. "We are approaching the 72-hour evaluation point for measurable neurological improvement. That is standard." Brooke felt heat rise behind her ribs. Standard for whom? For critical care utilization, the coordinator said, still smiling. For best resource allocation, for continuity planning. Brooke looked at Mercer. "Doctor, the last scan was yesterday. The swelling window is not even stable yet." Mercer's jaw tightened. "He is non-responsive. The injury is severe. Prolonged ICU care is not therapeutic." One of the suited men spoke for the first time. His voice was smooth, with the soft edge of Washington. "Vice Admiral Crow's care will continue," he said. "The question is where. Our recommendation is transfer to a federal facility with specialized long-term neurological management." Brooke kept her voice level. "Which facility?" The man glanced at Lydia, then back to Brooke. "Naval Medical Center. He will be more appropriately housed." More appropriately housed. Brooke had heard that phrase used for inmates in county hospital custody. She had heard it used for people nobody wanted to see. Lydia tapped her tablet. "We have a preliminary transport window within 48 hours. Brooke's mouth went dry. "Transport for a ventilated coma patient requires stability and careful handoff," Mercer replied before Lydia could. "He is stable." Brooke almost laughed, but she kept it trapped behind her teeth. Stable. Yes, that was the whole problem. She set her hands on the back of the chair nearest her, grounding herself. "I am requesting advanced stimulation testing before any transfer decision," Brooke said. "Structured command following attempts with documentation." Mercer's gaze hardened. "Not indicated. He shows no voluntary movement." Brooke did not look away. "You have not proven he cannot. You have proven he has not." The room cooled. The case coordinator's smile slipped for a moment. Lydia's eyes narrowed as if Brooke had just made herself visible in a way Lydia did not appreciate. The suited man leaned back. "Are you suggesting the medical team's assessment is incorrect?" Brooke chose her words carefully. "I am stating there are documented physiological changes that correlate with specific environmental cues and specific visits. I am stating the case deserves confirmation through formal protocol." Mercer exhaled sharply. "This is a new nurse's interpretation of machine noise." Brooke's fingers tightened on the chair. She kept her tone even. "It is not interpretation. It is timing. The monitor log shows oxygen dips at the exact seconds a certain visitor leans towards the bed. It repeats." Lydia's voice stayed polite. "A certain visitor." Brooke did not say Miles Carver's name. Not in that room. Not with those men watching her like an equation. Mercer's voice sharpened. "You have been told to chart care, not to conduct investigations." Brooke met Mercer's eyes. "I am charting what the monitor records. That is care." The suited man's expression did not change, but his attention sharpened the way a dog's ears shift when it hears a sound it recognizes. Lydia closed her tablet with a soft snap. "We are not making accusations in this room." Brooke nodded. "Neither am I. I am asking for an evaluation." Mercer stood, denied. Brooke felt something heavy settle in her chest. She looked at Lydia. Who has the authority to deny it? Lydia's smile returned, smaller than before. The attending neurologist, and the chain of command that will be managing him after transfer. Brooke heard the hidden sentence inside the polite one. The chain of command had already decided. The meeting ended the way meetings ended when the outcome was written before anyone walked in. Lydia thanked everyone with a bright voice. Mercer left first. The two suited men spoke quietly to Lydia near the door, words too low for Brooke to catch. Brooke stepped out into the corridor and felt the fluorescent lights press down on her skull. Denise waited by the nurse's station. She watched Brooke's face and did not ask questions that could become answers. "They shut you down," Denise said. Brooke kept her voice low. "They are moving him within 48 hours. Denise's jaw tightened. "That is fast." Brooke nodded. "And it is not about medicine." Denise looked past Brooke toward the bed 12, then back. "Keep your notes off the chart." Brooke's throat tightened. "I am doing everything clean." Denise's eyes softened a fraction. "Clean is the only armor you get in a place like this." Brooke walked back into bed 12 and closed the door until it clicked, then opened it again, just enough to avoid drawing attention. The room greeted her with its steady mechanical breath like it had been waiting. She stood at the bedside and watched Vice Admiral Crow's chest rise and fall. Tubes and tape made him look smaller than he should have been. The bruising made his skin look like it had been painted with a hard hand. His jaw was set even in sleep. His hand lay on the sheet, fingers relaxed, as if he had decided not to spend energy where it could not help him. Brooke leaned close to his ear. "They are transferring you," she whispered. "Military facility. Paperwork is already moving." She watched the monitor. No reaction. Her voice lowered. "That means new doctors, new documentation, new security." Still nothing. Brooke swallowed. "And it means the people in suits get what they want." The ventilator hissed. The monitor beeped. She waited, eyes on his face, searching for the smallest fracture. A tear formed at the corner of his right eye. It did not fall quickly. It gathered, held, then rolled down into the pillow, as if even grief had to move on his schedule. Brooke's throat tightened so hard it hurt to breathe. She did not touch his face. She did not wipe it away. She let it be evidence. "I saw that," she whispered. "I will not pretend I did not." The monitor stayed steady, obedient, but Brooke felt the air in the room change. The tear did not make him weak. It made him real. A man could be strategic and still be human. She stepped back and forced herself into motion. She checked the trach ties. She assessed skin. She documented mouth care. She adjusted the blanket. Normal tasks performed like rituals, because rituals could keep panic from taking over. At noon, the trauma surgery fellow stopped by to review the Admiral's post-operative course. His name tag read Dr. Rafael Ortiz. He had the tired intensity of someone who lived on caffeine and consequences. Brooke caught him just outside the room. "Dr. Ortiz," she said, "can I ask a question about the crash injuries?" Ortiz looked at her. "Sure. Would you expect skid marks in a high-speed impact with a conscious driver?" Ortiz's brow creased. "Not always. Depends on conditions. Depends on brake system. Depends on whether the driver had time." Brooke kept her voice casual. "The intake note says no visible skid marks." Ortiz's expression tightened. "Who told you that?" "It is in the chart." Ortiz looked toward the bed 12. That vehicle was a government SUV. Modern systems. Anti-lock brakes. Sometimes you do not get classic skid. Brooke nodded, then chose her next words carefully. "But you would still expect deceleration, yes." Ortiz hesitated. "If brakes engaged, yes." Brooke kept her face neutral. "Would injuries differ if the driver never slowed?" Ortiz looked back at her, eyes sharpening. "High-energy trauma tends to be worse. More shear, more internal injury." Brooke nodded. "Thank you." Ortiz studied her for a beat. "You are asking like you already suspect something." Brooke kept her mouth closed for a second too long, then answered with the only safe truth. "I am asking because my patient's story does not fit his numbers." Ortiz's gaze lingered. Then he leaned closer, voice low. "Be careful. Federal patients bring federal mess." He walked away. Brooke returned to the station and opened the electronic record again, searching for anything labeled coordination or transport. Most of it was locked behind permissions she did not have. But one folder was visible, a routine communication thread between hospital administration and a federal liaison office. A new file had been attached. Vehicle Telemetry Summary. Brooke's cursor hovered over it for a moment, her heart thumping. She clicked. The summary was written in sterile bullet points. Sensor inputs, speed trends, time-stamped events. Brooke read it twice, then a third time. Brake pedal sensor registered full depression at 11:41 and 58 seconds. Vehicle speed remained consistent. Steering angle correction 2 seconds before impact. No significant deceleration detected. Brooke's mouth went dry. Full depression, no slowing. Her mind tried to find harmless explanations. Wet road, hydroplane, anti-lock, but the numbers stared back with cold indifference. Full brake input without deceleration was not hydroplane. Hydroplane still showed effort, still showed a fight. This looked like something else. It looked like a hand pushing down on a pedal connected to nothing. Brooke printed the summary to the station printer and tucked it under her clipboard like it was a lab result. She walked back to bed 12, closed the door, and stood by the Admiral's ear. They recorded brake pressure, she whispered. Full pressure. She watched the monitor. The heart rate rose 6 beats and held controlled like a man clenching a fist without moving his arm. Brooke swallowed, but the car did not slow. The heart rate tightened again, smaller this time. Confirmation without drama. Brooke leaned closer, voice steady. You knew. The monitor did not spike. It did not panic. It held steady again like a soldier holding formation under fire. Brooke stared at his hand. The fingers did not move. And you did not fight it, she whispered. The heart rate rose 3 beats, held, then returned to baseline. Brooke felt the room tilt. Not physically, but morally, like she had stepped onto a ship deck in high seas. She tried to imagine the moment behind the wheel. Rain on the windshield. Highway lights. Brake pedal going down. No response. A trained operator, recognizing sabotage not as a possibility, but as a certainty. And then instead of swerving into a guardrail to make it obvious, instead of laying on the horn, instead of causing a chaotic crash that could be written off as driver error, he had allowed the impact to happen clean and brutal. Brooke's stomach clenched. She leaned closer. Why? The monitor stayed calm. The ventilator breathed. Brooke did not expect an answer. Not in a voice. Not in a gesture. But the stillness itself felt intentional, like the question landed somewhere inside him, and he chose not to spend it yet. Brooke stepped back and sat in the chair by the bed, the one families used when they were waiting for a miracle. She sat there like she belonged there, as if she were just another nurse on a long day. In her mind, images surfaced from a rotation she rarely spoke about. Not because it was classified, but because it was ugly. She had done a short medical assignment overseas during nursing school, part of a joint training program that placed students in military trauma units for experience. She had seen men come in with eyes open and bodies silent, trapped inside themselves after blast injuries. She had seen others who could move, but chose not to, who had learned to mimic unconsciousness when interrogators leaned close. The lesson had been simple. A body that is gone is loose. A body that is hiding is tight in strange places, disciplined in small rhythms. You learn to watch the throat, the breath, the muscles around the jaw. Brooke looked at the Admiral's jaw now and saw the faintest tension under the skin like a wire pulled taut. Footsteps passed in the corridor. Brooke did not turn her head. She kept her eyes on the monitor. A knock came gentle and formal. Brooke stood and opened the door to find Lydia Park. Lydia smiled as if she were a friend dropping by. How is he? Brooke kept her tone neutral, stable. Lydia stepped just inside the doorway, her eyes flicking to the monitor like she expected it to reveal something. We are coordinating transport. The receiving facility wants updated notes. Brooke nodded. Those notes will reflect what we have observed. Lydia's smile tightened. Yes, observed. Brooke held her gaze. I would like to request a second neurological opinion before transfer. Lydia's eyes remained pleasant. You already asked. I am asking again, Brooke said, because the telemetry summary indicates brake engagement without deceleration. That suggests mechanical failure or tampering, and the patient's physiological responses correlate with specific stimuli. It warrants formal evaluation. Lydia's smile slipped for a fraction of a second. Nurse Callahan, you are not a crash investigator. I am the nurse watching his monitor, Brooke replied, and I am responsible for reporting anomalies relevant to his care. Lydia studied her, then nodded slowly as if she had decided to treat Brooke like a problem to manage rather than a person to persuade. I will consult with Dr. Mercer, Lydia said. In the meantime, chart only what is clinically relevant. Brooke's voice stayed even. It is clinically relevant if he is not truly comatose. Lydia's expression cooled. Be careful. She left without another word. Brooke closed the door and felt her hands tremble for the first time since the meeting. She pressed her palms against the bed rail until the trembling stopped. Her shift ended, but she stayed late again. Not because she wanted overtime, but because the unit's rhythm changed at night. At night, power moved differently. At night, doors opened that stayed shut during day shifts. She sat at the station and watched the corridor through the reflection in the glass, watching who passed, listening for the click of badge readers. When she heard Carver's steps, she recognized them now. The measured pace, the absence of hurry, the confidence that he did not have to justify being here. He arrived at 8:39, walking straight into the unit without greeting anyone. The guard at the entrance stepped aside as if he had been told to. Brooke kept her eyes on her computer screen. She typed notes that did not matter, then stood and walked into bed 12 a few seconds before Carver arrived, so she would already be present and could claim it as routine. Carver entered without looking at her at first. He went straight to the bedside, eyes on the Admiral. Still, nothing he said at normal volume, the voice of a man speaking for the cameras. Brooke remained near the IV pump. No change. Carver nodded, as if he appreciated efficiency. Then he leaned closer to the Admiral's ear and lowered his voice. The vote will pass without you, he whispered. Brooke watched the monitor. The heart rate rose 8 beats and held. Not panic, not fear. Something sharper that stayed controlled by force. Carver's mouth curved faintly. You miscalculated. He rested his fingers on the bed rail, almost tender. You should have signed the authorization. The heart rate held those 8 beats, then returned to baseline with a slow, deliberate release, like a door being closed quietly. Carver straightened and turned his head slightly toward Brooke. You are still here, he said. I am responsible for his ventilator, Brooke replied. Carver nodded. Good. Responsibility is important. He moved toward the door, then paused as if remembering something. He leaned back toward the Admiral's ear for one last whisper. You will not get the chance to testify. Brooke's stomach dropped, but her face stayed calm. Carver left. Brooke waited until the door shut, then moved to the bedside, fingers adjusting the IV line with practiced steadiness. Her voice dropped low. They are using paperwork, she whispered. They are using timing. No change. They are moving you to a place I cannot see. The monitor remained calm, obedient. Brooke leaned closer. If you want me to stop that transfer, I need to know what you want. She waited. The ventilator hissed. The monitor beeped. Then a tear formed again, smaller than before, and slipped into the pillow without a sound. Brooke closed her eyes for half a second, feeling the weight of it. The tear was not a plea. It was a signal of endurance, the kind you gave when you could not speak, but you were still deciding. Brooke opened her eyes and kept her voice steady. Hold still, she whispered. Do not give him anything. The monitor did not move. Brooke straightened, walked to the computer in the room, and opened a blank note field. She began typing clinically relevant observations in neutral language. Timed oxygen dips. Heart rate responses correlated with proximity and verbal stimuli. Evidence of possible preserved awareness. She saved the draft without submitting it. Back at the nurse's station, she asked Denise for one thing that sounded ordinary. Can you print me the policy on neurological anomaly reporting? Brooke asked. Denise looked at her for a long moment. You are going to do this. Brooke kept her voice low. I am going to document what I have. Denise nodded once and turned to the printer. A few pages slid out warm and crisp. Brooke took them and folded them into her pocket. She could feel the paper against her thigh as she walked back into bed 12. The room was dim now. The ventilator sounded louder in the dark. The monitor's glow painted pale light over the Admiral's face, making him look like a statue carved out of breath. Brooke sat in the chair by the bed and placed her clipboard on her lap. She did not speak for a long time. She listened, she watched. She let the rhythm of machines and hallway footsteps settle into her bones. Then she reached into her pocket, pulled out the printed policy pages, and turned them over on her clipboard. She took out her pen and began to write a report the way a nurse wrote a vital note, steady and exact while the monitor beside her kept its quiet promise of control. Brooke wrote the report in the same posture she used for medication calculations. Shoulders relaxed, jaw still, breath measured. She did not write like someone begging to be believed. She wrote like someone building a chain that could not be snapped without noise. Patient exhibits physiological responses inconsistent with deep coma. Repeated patterns of transient oxygen saturation decrease and controlled heart rate elevation temporally correlated with external verbal stimuli and close proximity interactions. Suspected preserved awareness or locked-in presentation. Request secondary neurological review and advanced stimulation protocol prior to transfer. She read it once, then again, stripping out anything that sounded like accusation. She removed every word that belonged to emotion. She left only what belonged to machines and timestamps. The clock on the wall clicked toward 2100. Outside the room, the unit lights stayed dim. The night staff moved like ghosts with clipboards. Brooke saved the draft and sat still for a moment, letting the silence settle. Then she walked to the nurse's station and asked Denise for access to the submission portal. Denise did not pretend she did not understand what Brooke was doing. She slid her chair back from the computer stood and leaned close enough that her voice would not carry. "You file that it triggers a chain," Denise said. Brooke kept her eyes on the screen. "That is the point." Denise's gaze held hers. "Once the chain moves, people start looking for the hand that pulled it." Brooke nodded. "I will be on the record anyway if I stay quiet. I am already in the room." Denise exhaled slowly, "Then do it clean." Brooke logged in using her credentials, the familiar hospital interface suddenly feeling like a weapon locked behind glass. The form required categories, checkboxes, contact details, the name of the attending physician. Brooke filled each field carefully. She attached the monitor log excerpts by reference number without exporting files. She listed timestamps in the description. She kept her tone clinical. When the form asked for justification, she wrote only one sentence more than necessary. "Transfer planning is underway for a ventilated patient with possible preserved awareness. Secondary review required to prevent misclassification." She hovered over submit. Her finger did not shake. She clicked. The screen confirmed receipt with a sterile message and a tracking number. It did not say congratulations. It did not say be careful. It simply acknowledged that something had begun moving. Brooke printed the confirmation page and folded it into her pocket. Paper again. Quiet again. Proof that could not be edited by someone with better permissions. Denise watched her fold it. "Now Denise said you do not talk about it to anyone who does not have to know." Brooke nodded. "I will not." Denise leaned back. "And you do not write anything in the official chart that sounds like a fight." Brooke kept her voice low. "Only observations." Denise's eyes softened, almost proud, then hardened again. "And you do not get alone in a hallway with that liaison if you can help it." Brooke did not answer because she could not promise it. She returned to bed 12. The Admiral lay unchanged, the room dim enough that his bruises looked like shadows. Brooke moved around him with practiced care, checking lines, verifying settings, performing mouth care, and repositioning with the precision of someone who refused to give any auditor a single loose thread. She leaned close to his ear as she adjusted the blanket, her voice barely more than breath. "I filed the report," she whispered. "It says nothing about sabotage. Nothing about him. It says only what the monitor proves. The heart rhythm stayed steady. Brooke swallowed. Hold still. The monitor obeyed. She stood, walked to the far corner of the room, and looked up at the security camera mounted near the ceiling. It was angled, mostly toward the bed, a default view set by whoever installed it. From where it sat, it captured the bed, the door, and a thin slice of space beside the ventilator. It would capture a visitor leaning over the Admiral, but not clearly enough to read lips or see micro-expressions. It would capture sound only if the system was configured for it, and Brooke did not know whether it was. She did not have to know. She only had to make sure the camera saw what it could, and that someone was paying attention when it happened. A nurse's hands could not rewrite policy, but they could reposition a cable with plausible necessity. Brooke walked to the camera mount and reached up with a gloved hand as if checking the wire. She shifted her grip, then made a tiny adjustment to the camera's angle, just a few degrees subtle enough that it still looked routine. But now the lens faced more directly toward the right side of the bed, the spot where visitors leaned in. She stepped back and glanced at the lens again. From the corner of her eye, she saw the Admiral's monitor remain calm, as if it approved. She went to the station and filed a separate ordinary request with hospital security. Family escalation risk. High-profile patient. Request periodic monitoring of bed 12 camera overnight. It was the kind of language administrators liked. It sounded safe. It sounded like liability management. It did not sound like accusations. A security supervisor acknowledged the request with a single line. Noted. Brooke did not need enthusiastic agreement. She needed attention. By 2300, the unit was quieter. The day shift had drained away. The night shift settled into routine checks, med passes, and soft conversations at the station. Brooke stayed near bed 12. She charted. She rechecked settings. She performed assessments with just enough visible motion to look normal. Inside, she felt like a wire pulled tight. At 2347, the badge reader on bed 12's door clicked. Brooke was already inside, standing near the infusion pump. She kept her gaze on the screen as the door opened behind her. Miles Carver stepped in. He paused just long enough to take inventory. The camera angle. Brooke's position. The lights. He saw her and did not hide his irritation. "You are working late," Carver said. "I am assigned," Brooke replied. Carver's eyes narrowed. "You have been assigned a lot." Brooke did not look at him. She adjusted the pump settings by 1 unit, a harmless correction, something she could justify on any audit. "I am maintaining a ventilated patient." Carver stepped closer, stopping at the foot of the bed. The dim light made his suit look darker, his face sharper. He glanced at the monitor as if he expected it to behave. Then he looked at Brooke. "You filed something," he said. Brooke kept her hands on the pump. "I file documentation every shift." Carver's mouth tightened. A report. Brooke turned her head slowly. If there is a concern about his neurological status, it is appropriate to request review. Carver smiled faintly, but it was not warmth. It was calculation. "You understand who you are challenging," he said. Brooke held his gaze. "I am not challenging anyone. I am advocating for evaluation." Carver's eyes hardened. "Evaluation delays transfer." Brooke's voice stayed even. "Then the evaluation will clarify whether the transfer is safe." Carver stepped closer to the bedside, leaning down toward the Admiral's face. He spoke at normal volume, first the voice of a man aware of cameras. "Admiral Crow," he said, as if delivering a concerned greeting. "We are arranging a facility better suited to your needs." The monitor stayed steady. Carver lowered his voice, leaning closer until his mouth was near the Admiral's ear. The camera now had a clean view of the angle of his shoulders, the way he shielded his words. "You should have stayed out of that vote," Carver whispered. Brooke watched the monitor with the focus of a sniper. The Admiral's heart rate rose 8 beats and held as controlled as a clenched jaw. Oxygen dipped 1 point, then recovered. Carver kept whispering. "You thought you could drag this into daylight," he said. "You thought you could walk into a hearing and make everyone behave." His voice sharpened, the patience thinning. "The contract would have brought in $5 billion for defense infrastructure. You were going to expose it. You forced my hand." Brooke's fingers stayed on the pump. She did not turn. She did not widen her eyes. She did not give Carver the satisfaction of seeing her react. The Admiral's heart rate stayed elevated, held like a weight. Carver's whisper lowered further. "You think this ends in a courtroom?" He leaned closer, his hand gripping the bedrail, knuckles pale for a moment. "You will not even wake up in time to testify." The heart rate tightened once more, then eased back down to baseline with a slow, deliberate control, like a steel door closing quietly. Carver straightened and turned toward Brooke. His eyes searched her face. Brooke met his gaze with the calm of someone reading a dosage label. "Visiting hours are over," she said. Carver stared at her for a long beat. Something flickered behind his eyes, not fear, not yet, but recognition that she was not the type to crumble. "You are overstepping," he said softly. Brooke replied with the same measured tone. "You are not clinical staff." Carver's mouth twitched, almost amused. "Be careful, Nurse Callahan." He turned and walked out, closing the door behind him with quiet finality. Brooke waited 3 full seconds, counting in her head, then moved to the bedside as if to adjust the blanket. She leaned close to the Admiral's ear. "You did what you needed to do," she whispered. "Stay still." The monitor remained calm. Brooke's throat tightened. She swallowed and forced her hands to remain steady as she cleaned a small spot of dried blood near the Admiral's IV site. She did not know with absolute certainty what the security team could hear or record. But she knew Carver had spoken like a man who believed he was alone, and she knew the camera now saw him clearly. At 0014, her workstation chimed with a new message. "Federal Medical Office response initiate secondary review. Advanced stimulation protocol requested. Immediate coordination required." Brooke's scalp prickled. The chain had moved faster than she expected. She printed the message, folded it into her pocket, and walked briskly to Denise. Denise read it once, then looked up. They responded fast. Brooke kept her voice low. "They want a test now." Denise's gaze shifted down the corridor toward the admin offices. "Lydia Park will not like this." Brooke nodded. "Dr. Mercer will not like this." Denise's mouth tightened. "Carver will not like this." Brooke felt the words settle in her chest. She did not reply. The unit phone rang at the station. Denise answered, listened, then held the receiver out to Brooke. "It is Dr. Mercer," Denise said. Brooke took the phone. "This is Nurse Callahan." Dr. Mercer's voice came through tight and clipped. "What did you file?" Brooke kept her tone calm. "A neurological anomaly report, based on monitor logs and observed responses." "You bypassed me," Mercer said. "I listed you as attending," Brooke replied. "The system required it." Mercer's breath sounded sharp. "You have created a situation." Brooke kept her voice steady. "The situation existed. I documented it." There was a pause, then Mercer spoke again, colder. "Do not touch ventilator settings again without an order." Brooke answered, understood. She hung up. Denise watched her. "You okay?" Brooke nodded once, yes. Denise did not believe her, but she did not press. At 0042, Lydia Park arrived in the ICU wing with her tablet and a forced smile. She walked quickly, heels soft on the floor, expression controlled. She stopped at the nurse's station and looked at Brooke as if Brooke were a misplaced object. "We received a federal request," Lydia said. Brooke nodded, yes. Lydia's smile tightened. "This will disrupt operations." Brooke kept her voice level. "It will clarify his neurological status." Lydia leaned closer, lowering her voice. "Do you understand what you have done?" Brooke met her eyes. "I followed policy." Lydia held the stare for a second longer, then straightened. "Dr. Mercer will conduct the review." Brooke shook her head slightly. "The request says a military neurologist will oversee by secure video." Lydia's jaw tightened. "We will coordinate." She turned away sharply and walked toward Dr. Mercer's office. The next 30 minutes moved like a storm building behind glass. Staff were quietly told to prepare bed 12 for evaluation. Lights would need to come up. The ventilator alarms would be adjusted for safe testing thresholds. The room would need to be cleared of non-essential personnel, then refilled with the right personnel. Brooke stayed calm, outwardly performing tasks with the practiced rhythm of a nurse who had done this 100 times, even though her stomach was tight enough to hurt. She checked the Admiral's lines again. She verified medication drips. She ensured sedation remained minimal and within protocol. She confirmed suction supplies were ready. She did not say Carver's name to anyone. At 0112, the badge reader clicked again. Brooke was inside. Miles Carver entered without his earlier polish. His face was tight eyes, sharp posture carrying impatience. He did not bother with greetings. "This is unnecessary," he said. Brooke kept her tone even. "A federal request is not optional." Carver stepped closer, lowering his voice. "You are delaying a federal decision," Brooke replied, simple and steady. "Then federal oversight can review the report." Carver stared at her as if he wanted to say something uglier than his role allowed. He glanced at the camera in the corner. Brooke watched him notice the new angle. Something small shifted in his expression. A fraction of caution. He moved to the bed anyway, leaning toward the Admiral's ear. His voice dropped. "You are still trying," he whispered. "Still playing soldier." Brooke watched the monitor. The heart rate rose 5 beats held, then returned. Carver straightened, eyes flicking to Brooke. "You think you're saving him." Brooke's answer was quiet. "I am protecting my patient." Carver's mouth tightened into something close to contempt. He turned and walked out. Brooke exhaled slowly through her nose. Her palms were damp inside her gloves. She changed gloves and washed her hands because it gave her a reason to keep moving. At 0114, the secure video connection request came through. Denise stepped into bed 12 with Brooke. Dr. Mercer entered a moment later, her face controlled but tight around the eyes. Lydia Park hovered near the door, then stopped, as if she knew she should not be fully present for what was about to happen. A tablet was placed on a rolling stand beside the bed. The screen flickered, then resolved into the face of a military neurologist in a dim office uniform, visible at the caller eyes direct. "Proceed," the neurologist said. "Advanced stimulation protocol. Command response. Minimal sedation. Record timestamps." Dr. Mercer's voice was clipped. "He is non-responsive." The neurologist's gaze did not soften. "Then the protocol will confirm that." Brooke stood at the bedside, hands ready. She felt Denise's presence behind her, steady as a wall. She felt Dr. Mercer watching her with suspicion and irritation, but Brooke did not look away from the patient. The neurologist on the screen spoke again. "Nurse Callahan, you filed the report." Brooke's voice stayed calm. "Yes, sir." "Describe your observed patterns," the neurologist said. Brooke chose her words like scalpel cuts. Timed oxygen dips and heart rate increases correlated with close proximity whisper stimuli by a specific visitor. Controlled recovery to baseline. Evidence of possible voluntary modulation of breathing in response to verbal cue. Dr. Mercer's lips pressed together. The neurologist nodded once. "Understood. We will proceed." Brooke placed 2 fingers behind the Admiral's ear just below the mastoid at the nerve point she had used before, careful and precise. She leaned toward the Admiral's ear voice, steady low enough to be private, but clear enough to be unmistakable. "Admiral Crow," she said, "if you can hear me, do not move until I ask." The ventilator hissed. The monitor beeped. The room went still in a way that felt different than quiet. It felt like everyone had stepped onto a minefield and was waiting to find out who would breathe wrong first. Brooke kept her fingers in place, gentle pressure, and waited for the neurologist's count. "On my count," the neurologist said from the screen, "we are looking for controlled response, not reflex, not random." Brooke watched the Admiral's face. His eyelids stayed closed. His jaw remained set. His hand lay still. The monitor stayed calm. Denise shifted slightly behind Brooke, then became motionless again. Dr. Mercer's gaze stayed fixed on Brooke's hands. In the corridor outside, footsteps passed, then stopped. A faint shadow moved across the glass partition. Brooke did not turn her head, but she knew the posture of power when it hovered nearby. Carver was out there close enough to listen, certain the world still belonged to him. Brooke lowered her voice 1 fraction more and spoke only to the man on the bed. "Hold," she whispered. The monitor remained steady, obedient, as the secure video screen waited, and the ICU lights seemed to hum brighter. pulling every eye in the room toward the stillness that had been mistaken for coma. The military neurologist's face on the screen stayed steady, eyes forward, voice even. "Begin," he said. Brooke kept her fingers behind the Admiral's ear, a gentle pressure that did not bruise, did not injure, only reminded the nervous system it was being asked a question. She leaned close enough that her words were private. "Admiral Crow," she said, calm as a chart note. "When you hear the count, respond only when I ask." Small, controlled. The ventilator hissed. The monitor beeped. The room held its breath. Outside the glass partition, the shadow shifted. A shoulder, a suit sleeve. The outline of a man who believed he could stop anything by walking into it. The door handle turned. Miles Carver stepped in without knocking, irritation sharpened into urgency. His eyes went first to the tablet screen, then to Brooke's hand placement, then to Dr. Mercer. "This is completely unnecessary," Carver said, voice raised just enough to fill the room. Dr. Mercer's face tightened, as if she wanted to agree, as if she wanted to protect her authority and her comfort at the same time. Lydia Park hovered near the door, her tablet clutched like a shield. The military neurologist looked into the camera, expression unchanged. "We are proceeding." Carver took a step forward. "This patient is non-responsive." Denise moved subtly, positioning herself near the door, a quiet barrier in scrubs. Her presence was not dramatic, but it was firm. Brooke did not look at Carver. She kept her eyes on the Admiral's face, on the lashes resting against bruised skin, on the jaw that held tension even in stillness. The military neurologist spoke again. "Nurse Callahan, count with me. We want command response, not reflex. Minimal movement. Confirm repetition." Brooke nodded once. Her voice stayed low, steady, "Yes, sir." Carver's mouth opened, ready to argue, but Dr. Mercer lifted a hand not to defend Brooke, but to preserve control of the room. "Mr. Carver," Mercer said, clipped, "step back." Carver stared at her as if offended, then took half a step back, eyes cutting toward Brooke. He held himself still, but his jaw tightened, as if he was grinding his teeth behind the polite mask. The military neurologist's voice came through the speaker, clear and flat. "Count." Brooke leaned close to the Admiral's ear. "Listen," she whispered. Small, only when asked. The neurologist began one. The ventilator pushed a breath in. The Admiral's chest rose with mechanical obedience. Brooke watched the monitor for the smallest change. Nothing. A clean, baseline line, calm, quiet. The neurologist continued. 2. Brooke's fingers kept pressure steady. She watched the heart rate. It climbed 4 beats. It held not like panic, not like pain, like a man tightening his grip on something invisible. Brooke felt the hair at the back of her neck lift. Carver's eyes flicked to the monitor. His face stayed composed, but the skin around his eyes tightened. The neurologist said 3. Brooke's voice slipped into the space beside the Admiral's ear. "Move your right index finger, just once." For a beat, nothing happened. The room stayed locked. The ventilator hissed, the monitor beeped, the tablet screen glowed. Then the right index finger rose, slowly, measured no tremor, no spasm. It lifted off the sheet as if it had been waiting for permission all week. Dr. Mercer froze. Lydia Park's lips parted, her smile gone. Denise's shoulders shifted as if her body had prepared to move before her mind decided to. Carver went still in a different way, like a man bracing for impact. His eyes stayed on that finger as if it had just pointed directly at him. The military neurologist leaned forward on the screen. "Repeat the stimulus." Brooke did not rush. She waited for the finger to settle back down because she needed control, not a flurry. She placed her fingers behind the ear again, same point, same pressure, and kept her voice even. "Admiral Crow," she said, "do not move until I ask." The neurologist's voice came through. 1. Ventilator breath. 2. The heart rate rose again, smaller this time, 3 beats held. 3. Brooke spoke quietly. Right index finger. The finger lifted again, slow, deliberate, as if the Admiral was proving he could do it on command, not on instinct. Dr. Mercer's face drained of certainty. She stared at the hand, then at Brooke, as if she had been forced to reevaluate the last 48 hours. The military neurologist's voice tightened into focus. Eye tracking. Nurse Callahan request gaze shift if possible. Minimal command. Brooke moved closer to the Admiral's face, careful not to block the camera's view. Her voice softened, not pleading, not excited, just clear. "Admiral," she said. "Open your eyes if you can, only a little." The eyelids did not fly open. They rose slowly like heavy curtains dragged by a hand that refused to show strain. His eyes were not glassy. They were not wandering. They were awake in the way an ocean looks awake at night, calm on the surface and endless underneath. He stared at the ceiling light for a long second. The pupils reacted. The focus held. The military neurologist spoke quickly. "Track. Ask him to look toward a target." Brooke swallowed, then lifted her chin slightly. "Admiral, look at the tablet screen." His gaze shifted slow but purposeful, moving from the ceiling to the bright rectangle beside the bed. His eyes landed on the military neurologist's face and stayed there. The room felt colder. Now Brooke said, voice steady, "Look to the foot of the bed." His eyes moved again, controlled, deliberate, and settled on Miles Carver. Carver's composure cracked. It was not a dramatic collapse. It was a subtle loss of control. A flicker of shock that turned his face pale around the mouth. His lips parted as if he were about to speak, but no sound came out. The military neurologist's voice came through, firm. "Can you hear us, Admiral Crowe?" One controlled response for yes. Brooke watched the monitor. The Admiral's heart rate rose, once a clean, single lift, then settled. The military neurologist did not blink. Good. Nurse Callahan confirmed with a second question. "Do you understand where you are?" Brooke leaned close. "Admiral, do you understand you are in St. Bridget ICU?" The heart rate rose again once, then returned. Dr. Mercer's hands trembled slightly as she reached for her pen, the first sign Brooke had ever seen that Mercer was human under the crisp certainty. Lydia Park backed toward the door, her tablet forgotten. Carver took a half step back, then another. His eyes darted toward the camera in the corner. He saw the red recording indicator that hospital security sometimes activated when there was risk. The color seemed to drain further from his face. The military neurologist's voice sharpened. "Secure the room. This is a conscious patient. Limit non-clinical personnel." Denise moved first, opening the door and speaking into the corridor in a low, authoritative tone. "Security," Denise said. "Bed 12, now." Carver lifted his hands slightly, palms open, the gesture of a man trying to look harmless. "This is out of context," he said, voice strained. "This is a medical issue." Brooke kept her eyes on the Admiral's face. The Admiral's gaze remained locked on Carver, heavy and unblinking. The military neurologist spoke through the speaker. "Mr. Carver, step out of the room." Carver stared at the tablet as if he could argue with a screen. "I am here under federal authority." The neurologist replied cold. "Under medical authority, you are done. Step out." Footsteps in the hall. Heavy, quick. 2 security officers entered, followed by a third with a radio. Their faces were serious, not theatrical. One of them glanced at Denise, then at the tablet screen, then at Carver. "Sir, the lead officer said you need to come with us." Carver's mouth tightened. "This is ridiculous." The officer did not argue. He simply stepped closer, angled his body, and waited for compliance. Carver looked at Brooke. "Did you do this?" he asked, voice low. Brooke answered with the kind of calm that came from refusing to play his game. "I followed policy." Carver's eyes flicked to the Admiral again. The Admiral did not blink. The lead security officer spoke into his radio. "We have confirmation of awareness and command response. Initiate incident protocol. Restrict access to bed 12. Carver's voice rose, desperation creeping in. "You cannot detain me in a civilian hospital." The officer's tone stayed flat. "We are escorting you while we clarify authorization." Carver opened his mouth again, then shut it. He knew the difference between a conversation and a corridor with cameras. He walked out, with security shoulders stiff, head held high, but his eyes kept darting. He looked like a man who had rehearsed victory and never rehearsed this. When the door closed, the room exhaled. Dr. Mercer turned to Brooke, face tight. "How long did you suspect this?" Brooke kept her voice low, since the first liaison visit. Mercer's eyes flashed. "You should have escalated sooner." Brooke met her gaze steady. "I tried. I was dismissed." Mercer's mouth opened then closed again. The argument had nowhere to land. On the tablet screen, the military neurologist spoke. "Stabilize. Keep him ventilated. Begin formal communication assessment as tolerated. Preserve all monitor logs and all security footage." Denise nodded once, understood. Brooke leaned close to the Admiral again, her voice softer now. Not because she felt sentimental, but because a conscious patient deserved a human tone. "You did it," she whispered. "Stay steady." The Admiral's eyes shifted toward her. He did not smile. He did not soften. He simply looked at her as if recording her face the way he recorded everything else. Brooke felt her throat tighten. She blinked and returned to the work because the work was the only safe place to put emotion. Within minutes, the ICU changed its rhythm. Nurses moved with purpose. Dr. Mercer ordered a full reassessment, scanning orders, revised sedation, reviewed a speech consult scheduled. Lydia Park returned with an expression that tried to rebuild professionalism over shock. Her phone pressed to her ear, voice low. Brooke heard fragments as Lydia passed the doorway. "This changes the transfer. Cancel the transport. Yes, immediately. Notify receiving." Carver did not return. Instead, a different kind of presence arrived. Two men in plain clothes with Pentagon credentials, a woman in uniform with an internal affairs badge clipped to her collar. They did not speak loudly. They did not ask for opinions. They asked for records. A security supervisor approached Brooke at the nurse's station, eyes steady. "Nurse Callahan." Brooke looked up. "Yes, we have your monitoring request from earlier," he said. The camera feed was active. Brooke held his gaze. Was audio active? The supervisor hesitated, then nodded. "Yes, risk flag triggered full recording." Brooke's pulse beat hard once. She kept her face neutral. "Preserve it. It is already being copied to secure storage," he said. Chain of custody initiated. Denise leaned in beside Brooke, voice low. "Does it capture his bedside whispering?" The supervisor's eyes flicked toward bed 12. "It captures enough." Brooke understood what enough meant in the mouth of a security professional. It meant clear voice, clear admission, clear posture. It meant the difference between suspicion and a file that could not be waved away. Dr. Mercer walked up behind them. Her voice clipped. "We are not discussing this at the station." The security supervisor gave a small nod. "Understood, Doctor. We will coordinate with administration and investigators." Brooke returned to bed 12. The Admiral lay still, ventilator steady, but his eyes remained open now, tracking the room with slow, deliberate motion. He looked exhausted, not from injury alone, but from the effort of control. Brooke leaned close. "I need you to conserve energy. Blink once if you understand." He blinked once, slow. Brooke nodded and adjusted his pillow. She checked his mouth care again, then suctioned carefully, gentle, quick. His heart rate rose slightly, then returned controlled. Dr. Mercer entered, followed by the internal affairs officer. The officer looked at the Admiral, then at Brooke. "He can hear." Brooke answered simply, "Yeah." The officer's expression stayed professional, but her eyes sharpened. "We will need statements from staff. We will need full logs and visitor history. We will need every access record." Mercer replied tight. "We have been treating him as comatose." The officer did not accuse. She only nodded. "That will be addressed." Brooke watched the Admiral's eyes shift to the officer, then back to Carver's empty spot near the foot of the bed, as if the Admiral could still see him there. Hours later, as morning light pushed into the unit, the hospital felt like a different place. It still smelled of bleach. The machine still hissed and beeped, but the air carried an edge that had not been there before, an awareness that something bigger had bled into the building. The transport team, scheduled for 6 in the morning, never arrived. The paperwork vanished from the system, replaced by a cancellation note signed by someone Brooke had never heard of, a name stamped with federal authority. By mid-morning, investigators were on site. Not the local police in uniforms, but forensic engineers with cases and sealed bags. They spoke with the hospital's liaison office, then requested the vehicle telemetry records directly. They asked for the SUV's event data recorder, the brake system module, the wiring harness. They asked for the crash scene photographs. They asked for the report that said no skid marks. Brooke caught a glimpse of one engineer in the hallway, gray hair, calm eyes carrying a thin folder. He spoke quietly to the internal affairs officer. "This is consistent with electronic interference," he said. "Brake input recorded. No actuation. That is not driver error." Brooke did not move. She did not insert herself into the conversation. She simply let the words land. Inside bed 12, the Admiral drifted in and out of fatigue. The speech therapist attempted a few simple tests, but the tube made it hard. The military neurologist remained connected by secure video in intervals, reviewing imaging and planning a pathway for communication. By afternoon, the Admiral could form one word rough and scraped a sound dragged up from a throat that had been breathing with assistance. The military neurologist asked, "Admiral Crow, can you confirm identity?" Brooke leaned close. "If you can say your last name." The Admiral's eyes closed briefly, then opened. His lips moved around the tube and tape. "Crow," he rasped, voice raw. It did not sound triumphant. It sounded like survival. Dr. Mercer stood at the foot of the bed, silent, her posture different now. Less certain. Less defended. The internal affairs officer watched Carver's name on a file and spoke to a colleague in the hallway. "We have audio of motive," she said. "Contract, vote." He forced my hand. "No chance to testify." Her colleague nodded. "That supports detainment." Brooke heard footsteps, then saw Carver being escorted past the unit entrance. Not in handcuffs, not in a dramatic scene, but held by two federal agents with calm hands. Carver's face was composed again, the mask rebuilt, but his eyes looked empty. He caught Brooke's gaze for a split second. His mouth tightened. Then he looked away as if she were beneath him, as if refusing to acknowledge her could preserve his dignity. The Admiral's eyes tracked Carver as he passed, slow and unblinking. Carver disappeared down the corridor. A week later, the ICU returned to routine in the way hospitals always did. Not because the story ended, but because the building did not have the luxury of pausing. New traumas arrived. New families cried in hallways. New monitors beeped in rooms where nobody slept. But bed 12 stayed marked. The staff spoke about it in low voices, not with gossip, but with caution. The Admiral was moved eventually not in the quiet dawn transfer planned by paperwork, but under a protocol that included oversight witnesses and documentation. He was taken to a rehabilitation wing in a federal medical facility where communication specialists and neurologists could work with him without the pressure of a rushed timeline. Brooke returned to her shifts. She charted other patients. She adjusted other ventilators. She cleaned other blood. But the sound of that controlled finger lift stayed in her body like a memory of electricity. She was called into administration 2 days after the event. Lydia Park sat behind a desk, face arranged into professionalism again. A hospital lawyer sat to the side. An internal affairs representative sat across from Brooke with a folder. Lydia spoke first. "Nurse Callahan, you created a significant disruption." Brooke looked at Lydia without blinking. "I followed reporting policy." The lawyer cleared his throat, but the internal affairs representative spoke instead. "She filed appropriately," the representative said. "Her documentation is clean. Her observations are supported by logs." Lydia's smile tightened. The hospital faced reputational risk. Brooke's voice stayed level. The patient faced a transfer that would have prevented proper evaluation. Silence filled the office. Lydia's eyes narrowed, then she looked away as if she had found no place to put her frustration. The internal affairs representative closed the folder. "Thank you, Nurse Callahan. We will contact you if further statements are required." Brooke stood, nodded once, and left the office. Her legs felt steady. Her hands did not shake. 3 weeks later, she received a request to meet a federal investigator in a quiet hospital conference room. The investigator did not offer dramatic praise. He did not offer fear. He asked precise questions about timing access monitor behavior and visitor interactions. Brooke answered with dates and numbers. She handed over her personal pad of notes, the paper she had protected like a secret. The investigator accepted it with a nod and placed it into an evidence envelope. "You did not put interpretations in the chart," he said. No, Brooke replied. That was wise, he said, as if wisdom was simply another clinical skill. Outside, the hospital news broke in controlled waves. A defense procurement scandal, a suspended liaison, a reopened crash investigation, a specialized brake system override confirmed by forensic engineers. The phrases were dry. The reality behind them was not. Months passed. The Admiral's recovery made headlines, but the headlines simplified what the body did not. They showed a photo of him sitting upright, then another of him standing with a cane. They never showed the hours of speech therapy, the frustration of muscles that refused to obey the silence between words when the mind worked faster than the mouth. Brooke saw him once on a secure broadcast in the break room, the television muted again out of habit. He was thinner. His shoulders looked narrower in a suit, but his eyes looked the same, alert, patient, unmoved by the spotlight. 6 months after the crash, he testified before Congress. Brooke did not watch it live at the hospital. She watched later at home, sitting alone at her kitchen table, the same place she had sat with timestamps and coffee she did not taste. On the screen, Vice Admiral Nathaniel Crowe raised his right hand to swear in. He moved slowly, but the motion was deliberate. His voice sounded rougher than she remembered from the brief word he had spoken in ICU, but it carried weight. He spoke about procurement, about pressure, about a vote that redirected billions, about documentation that disappeared when people believed time would erase it. He did not speak about Brooke by name. He did not need to. The record spoke for itself. 2 days after he regained stable speech, a message arrived at St. Bridget's administration office requesting a private visit. The request came with federal paperwork and a date. Brooke was told at the beginning of her shift. Denise approached her at the station and slid a note across the counter without comment. Brooke read it. Vice Admiral Crowe will arrive at 1600 hours. Private meeting requested with Nurse Brooke Callahan. Brooke folded the note once and placed it in her pocket. Her stomach tightened. She did not know what the meeting would feel like. She only knew it would not feel ordinary. At 1600, the unit doors opened and a small group entered. 2 uniformed escorts stayed near the entrance. An administrative aide carried a folder. A hospital security supervisor walked alongside them, alert. Vice Admiral Crowe stepped in last. He wore his uniform, pressed sharp ribbons, aligned posture straight. The cane in his left hand was plain and functional. He used it without apology. His gait was slow-controlled, as if he refused to let anyone see him hurry. The ICU staff watched from a distance, trying not to stare. Some nodded. Some looked away. Crowe did not seek attention. He moved like a man used to being observed and trained to ignore it. Denise met him near the nurse's station, Admiral. Crowe nodded once, thank you. His eyes found Brooke immediately, not with warmth, not with threat, but with recognition. The way you recognized a person who had stood beside you when the room was dangerous. Brooke stepped forward, hands at her sides. Sir. Crowe's voice was quieter than his public testimony, rough but steady. Nurse Callahan. Denise opened the door to an empty consultation room off the unit. The room smelled of disinfectant and old coffee. A small table sat in the center. 2 chairs. No cameras inside, at least none visible. A window looked out into the hallway, but the blinds were partially closed. Denise stayed outside and shut the door. For a moment, Brooke and Crowe stood facing each other in silence. Crowe broke it first. You knew. Brooke did not pretend confusion. I suspected. Crowe's eyes narrowed slightly. From the beginning. Brooke nodded once. Your vitals were too disciplined. A faint expression flickered across Crowe's face. Something that might have been amusement if it were not tired. I spent my life training control, he said. Brooke replied without softness. Control leaves fingerprints. Crow looked at her for a long moment, then lowered himself into the chair with careful movement. The cane rested against the table edge. His hands folded, still patient. He did not speak for several seconds. Brooke remained standing until he gestured to the other chair. "Sit," he said. Brooke sat. Crow's gaze held hers. "Where did you learn to see it?" Brooke kept her answer simple. "I did a rotation overseas. Trauma units. Some patients could not move. Some could but chose not to. You learn the difference." Crow nodded slowly. "I was counting on someone." Brooke's throat tightened. "That is a hard thing to ask of a stranger." Crow's voice stayed calm. "It was harder to ask of anyone I could name. Anyone I could name was already being watched." Brooke looked at his hands. The right index finger, the one that had lifted, rested still now. She remembered the way it rose off the sheet like a signal flare that did not want to burn too bright. "You did not fight the crash," Brooke said. Crow's eyes stayed steady. "No." Brooke held his gaze. "Why?" Crow exhaled slowly, as if choosing words mattered. "If I walked away clean," he said, "they would have erased it. They would have called it a scare, a misunderstanding. They would have moved the vote. They would have sealed the records." Brooke listened without moving. Crow continued. "A dead admiral ends an investigation. A living admiral who is awake can be managed, redirected, drowned in procedure. But a coma freezes the system. It forces waiting. It forces people to stand around the bed and talk like the patient is gone." His eyes hardened slightly. "People get careless when they believe the room cannot hear them." Brooke remembered Carver's voice, low and bitter, talking about 5 billion like it was a birthright. "You made yourself bait," Brooke said. Crow nodded once. Bait that could listen. Brooke's jaw tightened. And if no one noticed. Crow's gaze did not drop. Then it would have ended the other way. Silence filled the room again. Brooke felt the weight of that statement in her chest, not as a lesson but as a fact that could have happened. Brooke spoke quietly. "You were partially paralyzed. Even if you wanted to stop the act, you could not." Crow's mouth tightened slightly. That was the risk. Brooke stared at him, feeling a sharp edge of anger that did not need to be loud to be real. "You trusted the wrong kind of risk." Crow's eyes softened a fraction. "I trusted the only kind available." Brooke's hands rested on her thighs. "You could have gotten me fired." Crow's voice stayed calm. "You protected yourself. You documented clean. You used policy." Brooke looked away for a moment, then back. "I used policy because power respects paper." Crow's expression shifted a faint approval. "Exactly." He paused, then spoke again, quieter. "When you whispered the first time, 'Do not move,' I understood. You were telling me you saw the trap. You were telling me to stay inside it." Brooke's throat tightened. She forced her voice steady. "I did not know if you would understand." Crow's eyes held hers. "I did." They sat in silence for a long moment. Through the blinds, Brooke could see shadows moving in the hallway, nurses doing their work, the unit continuing. The world did not stop for anyone's story. Crow reached into his uniform pocket and pulled out a folded paper. He slid it across the table. Brooke did not touch it immediately. "What is that?" "Official commendation request," Crow said. "For your file, for your career. You can accept it or not." Brooke stared at the paper. "I did my job." Crow nodded. "And your job did not do you favors. That is why I put it on paper." Brooke finally touched the page, then pushed it back slightly. "Keep it. If I need it, I will ask." Crow's mouth curved, faintly tired, still controlled. Brooke did not smile. Not because she did not feel something, but because she had never needed recognition to do what she did. She needed clarity. She needed the record to match reality. Crow stood slowly, using the cane posture, still straight. He looked at Brooke for a long second. "You were the only person in that room who understood restraint." Brooke rose as well. "I understood the monitor." Crow's eyes narrowed slightly. The monitor was honest. Brooke nodded. People were not. Crow lifted his right hand and gave a small, precise salute. Not ceremonial. Personal. Clean. Brooke did not salute back. She met his eyes and gave a single nod, the same nod she had given the day she told him to stay still. Crow turned toward the door. Before he opened it, he spoke without turning back. Carver thought silence meant surrender. Brooke kept her voice low. Silence means someone is listening. Crow paused, then opened the door and stepped back into the ICU corridor. The unit staff watched him pass. Some stood a little straighter. Some looked down at charts. The machines kept beeping. The ventilators kept hissing. The building kept breathing. Brooke returned to bed 12, now empty. The sheets changed the monitor to detach the room assigned to someone else. She stood for a moment in the doorway looking at the space where a man had been forced to disappear in plain sight. Then she turned away and walked back to the nurse's station, pen in hand, ready for the next set of numbers that would try to tell the truth quietly.